Hello, and welcome to the second module of the SBIRT training for the social work program, Screening Clients for Substance Use in Your Practice Setting. I'm Mo Cuevas, and I will be walking through this PowerPoint with you to help you learn how to do the screening. By the end of the session, you'll be able to understand why we universally screen, identify the potential impact of substance misuse and abuse, identify substance use risk limits, identify how screening is conducted. You'll eventually get a chance to practice 2 screening tools, and you'll understand how screening is used in brief intervention. The rationale for universally screening is that drinking and drug use are common. They can increase the risk for health problems, psychosocial problems, lots of different issues. The use often goes undetected, and people are actually more open to change than you might expect. We screen universally so that we can detect current problems at an early stage before they result in more serious disease or other problems. We want to detect use patterns that might put people at risk. We want to intervene and educate about at-risk alcohol and other substance use. And research has shown that approximately 90% of substance use disorders go untreated. So we're trying to set out a way to find that 90%. If we detect risk factors early, it leads to better outcomes. And clients are often being seen by a social worker because of a related psychosocial problem. So the social worker is often the first point of contact. The prevalence of substance use in the United States is high, and it's growing. These statistics are taken from the National Survey on Drug Use and Health from 2008. On individuals aged 12 and older in the United States, talking about their past month usage. So if you look at the numbers, for women, 45.9% of the women said that they currently drink, and 57.7% of the men said they currently drink. Tobacco use, illicit drug use, and misuse of prescription drugs were also problematic. Based on the findings of screenings, you will typically find that 40% of the people you screen are low risk, 35% are at risk using, 20% are harmfully using, and 5% are dependently using. There are many health impacts for alcohol and drug misuse. Hypertension, heart disease, liver disease, depression, risk for cancers, HIV/AIDS, other STIs, trauma, even possibly disability. There's a pre-screening strategy that we use one brief pre-screening question, and from that decide if we need to do further assessment. Research shows that about 75% of the responses will be negative, which means that 25% will be positive, and you should ask further assessment questions. The alcohol pre-screening question: do you sometimes drink beer, wine, or other alcoholic beverages? If they say no, you're done. If they say yes, you move into the single screener. How many times in the past year have you had 5 or more drinks in a day? That would be for men. Or how many times in the past year have you had 4 drinks or more in a day if you're working with women or clients over the age of 65? If they give an affirmative answer, meaning they have done that, you move on to a full screen. The pre-screening drinking limits What you're trying to do is determine the average drinks per day and average drinks per week that a person is consuming. So you ask different questions. On average, how many days a week do you have an alcoholic drink? On a typical drinking day, how many drinks do you have? So that's your daily average. And the weekly average equals the days times the drinks. The recommended limits are that men should have no more than 14 drinks a week, and that women or anyone over 65 should have no more than 7 drinks per week. Anything over the regular limit is an at-risk drinker. A positive alcohol screen means you have an at-risk drinker. Do you binge drink? More than 5 for men or more than 4 for women? Or exceed regular limits? 2 per day for men or 1 per day for women? If those are true, the answer is yes, your client is at risk and you want to screen using the audit. If that's not true, you don't need to go through the screening process. Studies demonstrate that the 5 or 4 limits accurately reflect the amount of alcohol consumed at which psychomotor and cognitive impairment is notably increased. It also increases the risks of unintentional injuries, deaths from external causes, being a target of aggression or taking part in an aggression-related event, alcohol use disorders, and unfavorable medical, work-related, legal, and social consequences related to the drinking. As the frequency of exceeding the guidelines increases, the likelihood of developing these problems also increases. There are several studies that talk about how often people drank more than 5 drinks in a given day. The findings indicate that exceeding the limits given can significantly increase alcohol-related problems. When we're screening, it's useful to clarify what one drink is. One drink is a 5-ounce glass of wine, a 1.5 ounces of liquor, or 12 ounces of beer. The equivalency is 14 grams of pure alcohol. The audit is the Alcohol Use Disorders Identification Test. It's a 10-question self-administrated or through an interview that addresses recent alcohol use, dependence, symptoms, and alcohol-related problems, and it was developed by the World Health Organization. The strengths are that it's free and the manual is free. It's been validated in multiple settings. It's brief and flexible, and it focuses on recent alcohol use. It's also consistent with current definitions of dependence, abuse, and harmful alcohol use. The only limitation is that it doesn't screen for drug use or abuse, just alcohol. Here's the 10-question questionnaire. I know it's hard to see. I will be posting this so that you can look at it after the slideshow is over. It has 3 domains: hazardous alcohol use, dependence symptoms, and harmful alcohol use, trying to find out where people fall. Scoring the audit, you end up with the same percentages. People who score in the low risk category end up with a score of 0 to 7. The at-risk category is 8 to 15. The harmful use category is 16 through 19, and the dependent use is 20 or above. We also do a pre-screening for drugs. How many times in the past year have you used an illegal drug or used a prescription medication for non-medical reasons? If the response is none, you're finished. If the response has other clues, you ask more. Any positive drug pre-screen question puts the client in an at-risk category. The follow-up questions are to assess the impact and whether substance use is serious enough to warrant a substance use disorder diagnosis. So you ask which drugs the client has been using, you determine the frequency and quantity, and you ask about negative impacts of the drug use. Prescription drug misuse is a bigger problem than we realize. Although many people take medications that are not prescribed to them, there are some that are more problematic than others. Opioids, stimulants, sleep aids, and a handful of others. The DAST-10 is a shortened version of the DAST-28 that contains 10 items. It can be completed as a self-report or through an interview, and it consists of screening questions for at-risk drug use that parallel an alcohol screening instrument. It was developed by the Addiction Research Foundation. It yields a quantitative index of problems related to drug misuse. It's a sensitive screening tool for at-risk drug use, but it does not include alcohol use. Here is the DAST questionnaire, which I will also post. You literally either ask the questions or have your client circle the answer on their own. The interpretation is that if the score is 0, there are no problems reported and nothing needs to be done. Each yes response is a 1 point. If they say 1 to 2 points, it's a low level and you just monitor. 3 to 5 is a moderate level and you need to investigate further. And 6 to 8 is a substantial level and needs intensive assessment. Scoring the DAST is the same. 40% are abstainers. 35% get a 1 or a 2, which is hazardous use. 20% get a 3 to 5, which is harmful use. And 5% get a high risk, which is 6 or above. The key points for screening are to screen everyone. Screen both alcohol and drug use. Use validated tools. Pre-screening is usually part of another survey. Explore each substance. Follow up positives or red flags by assessing the details and the consequences. And then use your motivational interviewing skills, which you'll learn later, and show non-judgmental, empathetic, verbal and non-verbal behaviors during the screening.